The rise of mommy wine culture has become a concerning trend, especially since the onset of the COVID-19 pandemic. What was once a playful, almost humorous portrayal of moms using wine as a coping mechanism has evolved into a disturbing reality with alarming consequences. Initially depicted on social media as a way for mothers to unwind and laugh off the stresses of parenting, this culture has now contributed to a 41% increase in alcohol consumption among women. This increase has not only brought about physical and mental health problems, but has also played a significant role in the disturbing rise of women's drinking habits, which even surpassed men's consumption in 2021, according to the National Institute on Alcohol Abuse and Alcoholism, NINA. While it may seem like harmless fun, the true toll of this trend is beginning to reveal itself, and the statistics are troubling. At the core of the issue is the idea that alcohol, particularly wine, has become normalized in a way that makes it almost socially acceptable, if not expected, for women to drink to cope with the pressures of motherhood. The image of the wine-drinking mom, often seen smiling with a glass in hand after a long day of juggling the demands of family, work, and personal life, sends a subtle yet powerful message. It tells women that it's okay to rely on alcohol to manage the chaos of daily life. What starts as a small glass of wine after dinner soon becomes a nightly routine, and before long, it can escalate into more frequent drinking habits that blur the line between relaxation and dependency. The health implications of this trend cannot be overstated. According to Dr. Mary Jean Mimi Hartkier, a chief medical officer at United Healthcare, alcohol consumption can have dire consequences on a woman's health. The impact of alcohol on women's bodies is often underestimated, particularly when it comes to the cardiovascular system, the brain, and the risk of certain cancers. Women process alcohol differently from men, breaking it down more slowly, which means that smaller amounts of alcohol can have a disproportionate effect on their bodies. For example, binge drinking is defined for women as consuming 4 or more drinks within a short period, and heavy drinking is considered to be 8 or more drinks per week. Yet, in states like Minnesota, where 15.4% of women report heavy or binge drinking, these numbers are indicative of a broader issue that should not be ignored. One of the most concerning consequences of alcohol consumption, especially in the long term, is the increased risk of developing cancer. The Surgeon General's recent warning about the link between alcohol use and cancers of the gastrointestinal tract, including mouth, throat, and liver cancer, has shed light on a sobering reality. These cancers can be devastating, often requiring extreme treatments like feeding tubes and long-term medical care. The reality is that drinking, especially in excess, is not a harmless indulgence. It is a serious health risk that can contribute to diseases that take years off one's life. Moreover, alcohol consumption during perimenopause, a time when women are already dealing with fluctuating hormones and the challenges of aging, compounds the risk. Dr. Hartkia points out that alcohol can increase the levels of estrogen in the body, which is particularly dangerous for women during this phase of life. The risk of breast cancer, already elevated during menopause due to hormonal changes, is further amplified by alcohol use. This is a warning that women in their 40s and 50s should take seriously, as alcohol can exacerbate the very hormonal changes that make them vulnerable to cancer. The cognitive consequences of alcohol consumption are also noteworthy. Chronic drinking can impair memory, decision-making, and even personality. Over time, it can lead to alcohol-related dementia, a condition that significantly diminishes a person's quality of life. What might start as an occasional glass of wine to cope with the stress of parenting can ultimately result in irreversible damage to the brain. Yet, this aspect of alcohol use is often ignored in favor of the more socially accepted narrative that alcohol is simply a part of daily life for women. What is particularly alarming is how easy it is to slip into unhealthy drinking habits. Alcohol addiction does not happen overnight. It is a progressive disease, meaning it develops slowly and often without the individual realizing the extent of the problem. Dr. Hartkier explains how alcohol creates a cycle of dependency by surging dopamine in the brain, which initially creates a feeling of pleasure. Over time, however, the body compensates by decreasing its response to dopamine, requiring more alcohol to achieve the same effect. As a result, what may start as a few drinks becomes a bottle, or more, per day. The fact that alcohol can gradually escalate to this point without the person realizing it makes this a particularly insidious issue. For women who feel that their drinking habits are becoming problematic, Dr. Hartkia emphasizes the importance of seeking help and being honest about the situation. One of the first steps in addressing alcohol dependency is acknowledging that there is a problem. This can be difficult, especially when the drinking culture around women is so pervasive and normalized. Friends, family, and even social media often celebrate and promote the idea that drinking is an essential part of being a good mother or a fun woman. This normalization of alcohol use can make it harder for women to break free from the cycle of dependency. Taking steps toward reducing alcohol consumption can start with something as simple as taking a break. Initiatives like Dry January, where people refrain from drinking for an entire month, have become popular ways to reset and reassess drinking habits. According to Dr. Hartkier, taking a break from alcohol for just 10 days can help the body clear out the effects of alcohol and provide a sense of how much better one can feel without it. However, even after such a reset, the temptation to return to old habits is strong. That's why having a support system, whether it be a doctor, friends, or even tracking apps, can be crucial in making lasting changes. Ultimately, the rise of mommy wine culture reflects a broader societal issue. It highlights how the pressures of modern motherhood and societal expectations can lead women to rely on substances like alcohol to cope. This cultural shift is not harmless. It has serious health consequences that can affect women's bodies, brains, and overall well-being. While it may be tempting to laugh off the images of moms sipping wine after a long day, the reality is that alcohol consumption is a serious health risk that cannot be ignored. The statistics are disturbing, and the need for women to question their drinking habits has never been more urgent.